A rise in RSV, the flu, and COVID-19 put added pressures on the healthcare system last year, leading to longer wait times in the ER. But what are the trends this year, especially as Canadians are set to gather with loved ones for the holidays? To help us answer that question, we have ER Dr. Kashif Pirzada joining us now from Toronto. Thank you so much for being with us today.
Thank you.
Okay, let's get right into it. How busy are hospitals and emergency rooms right now?
They're quite busy. Like, we are admitting a lot of young children and folks over 65. And this started about a week or two ago. And I'm just worried about what's going to happen in the next week or two during the holidays.
So what's behind the uptick that you're seeing right now in patients?
So it's definitely flu, COVID, RSV, and all the other respiratory viruses. They're hitting hard. And I feel like the awareness is not there in the public that this stuff is out there because we are just getting overwhelmed right now.
And so how are hospitals preparing? I know it's already hitting you, but how are you preparing, and is it expected to get worse?
Oh, yeah. So we've tried to staff up during the holidays. We're getting a lot of sick calls among staff members, but we're trying to implement plans to get more staff in. But we're always short on nurses and doctors, especially now. It's not uncommon on a day when you have 10 doctors working, 2 or 3 are sick right now. So that's becoming a problem as well. So it is a huge challenge to keep staffed during this holiday season.
Can you walk us through who should be going to the ER and who shouldn't be? At what point do you know that you need that extra help and need to head to the hospital?
Generally, especially in kids, so a fever lasting longer than 5 days is a bit of a red flag for us. If you're having trouble breathing, like if you notice the chest is rising, going up and down fast, not eating or drinking, that's another red flag for us. Sleeping too much, that's another sign. So basically, if you're worried, if you think things are beyond the normal, very mild cold, that's a reason to get checked out. And we're happy to see. We'll try our best to get you guys in, but we have to, take care of your kids, look at them closely, look out for those signs.
Of course, and because you want people to go to the ER room if they need that help.
Exactly. Like, here we have in the ER, we have equipment like oxygen, we have machines that can help in those extreme cases. So when something crosses beyond the normal cold, like the 2-3 day sniffles, if things are just lasting longer, your kid is getting short of breath, your kid is not eating or drinking anything, that's a sign. Do not hesitate to come see.
So how can people stay safe during the holidays? There's a lot of gathering with loved ones, and so people want to be able to do that in a safe way. Do you have any tips for them?
Oh, yeah. So I would, stay home if you're sick. Stay home from work. Stay home from school. Don't ruin someone else's Christmas. That goes without saying. Get boosted if you're not sick already. So flu, COVID vaccines, RSV for elderly people. These are great tools, and they will keep you out of hospital. Also, I would, as of now, wear a mask in crowded indoor spaces. So crowded malls, subway trains, buses, planes, don't pick up whatever it is out there and bring it home and ruin Christmas.
And it's definitely busy out there, like the malls, people are out shopping, more people are taking transit right now, so definitely a good reminder there. I love this question because every September I start preparing kind of a kit, a just-in-case kit, just in case I fall sick, get a cold, a flu, and I always encourage my family to do the same thing. So it's full of, medication and soups, perhaps some electrolytes, making sure I get water and I have everything I need at home. I want to know, as a doctor, what are some things that we should have in our just-in-case kits?
So, I think Advil, Tylenol are great things. A kid who has a fever will not want to eat or drink, so keeping ahead of the fever is good. Keeping a thermometer is a good idea. Also, a humidifier can help, especially when congested. Vicks as well for older kids. Things like that, like keep medications for nausea, like Gravol is helpful. Sometimes antihistamines like Reactin or Benadryl can help sometimes. So generally some medications, humidifiers, other tools that can really help when your child or your family member is sick.
It's definitely good to have these things at home so that when that time comes, you're not out looking for everything.
Oh, definitely. Yeah, we're burning through our own stockpile. Like, our own kids are sick right now. So thank God, not COVID. Oh, yeah, I should mention a rapid test is very important too. If you can test, it really helps us in the hospital know if you have COVID or not. because that really changes some treatments that we give, especially for older people. We can give antivirals. So a rapid test is an important thing to stock as well.
Oh, right. Yeah, I just picked one up from the City of Toronto. They actually have them piled up at City Hall. So anytime
Yeah.
I'm there, I just grab one. And for anyone watching this, they're free. So feel free to go there and grab them yourself. They're also available at some libraries and other civic buildings. Dr. Kashif Pirzada, thank you so much for having this conversation with us. We really appreciate it.
Thank you. Merry Christmas and stay safe out there.
Thank you. Merry Christmas to you too. Take care.